everybody. Thanks for joining me here. Is Medicare Matters with Mackenzie. And today I am joined by Dr. Seivert, who is a chiropractor. And we're going to talk today a little bit about why chiropractic care is so important to continue as we age, and how Medicare covers it, and the intricacies involved with that. So, Dr. Seivert, please introduce yourself.
Yes, my name is Dr. Sean Seivert. I am a chiropractor. I specialize in the upper cervical area, meaning basically the upper portion of the neck. And we deal with all sorts of health issues, dealing specifically with the individuals with herniated discs, degenerative disc disease, arthritis, migraines, fibromyalgia. Oftentimes, these are the conditions that as an individual ages, they tend to notice more the symptoms of it. So as an individual hits that Medicare age, oftentimes they come running to us because they've been suffering and dealing with problems for many years by the time they come to us.
Well, how long have you been doing this?
I've been in private practice now for about 26 years. I've been here in Texas now for 17 years. I've practiced internationally. I've done mission trips to foreign countries and helped individuals. And so, I'm very well-rounded in dealing with individuals with families. I have quite a few families, infants, but I do have kind of a heart of dealing with elderly people because they oftentimes are the ones that are suffering, and they don't need to be. Oftentimes we think that the conditions that they have are just because they're getting old.
Right.
And I'm going to talk a little bit about that later on in the show, but
Right.
Just because you're getting old doesn't mean you have to live with pain.
Right. At any age, really, right?
Correct.
So my name is Mackenzie Anderson, and I help people with Medicare. So I'm in we call a licensed agent. So I help people when choosing a plan, when it comes to if they have any billing issues, and also a big part of my role as advocate is to connect them with quality providers. And so Dr. Seivert is one of those, and my family is one of the families that he does see.
Correct.
So, and I can attest to that. So I know you mentioned as we age, we don't have to live in pain. So why is chiropractic care so important for older adults? And what are some of I know you mentioned what you specialize in, but what are some of the most common ailments or complaints that you have seen throughout your 26 years?
So, obviously as a chiropractor, most individuals associate us with back pain, and that is a large percentage of the individuals that we are seeing are people that are coming in with some degree of back pain, and oftentimes many other health conditions that they don't realize are associated with that back pain. But as we start dealing with people as they age, we start dealing with much more specific problems, and we start dealing with a lot of individuals that have a lot of arthritic type conditions, meaning they just feel very stiff. They have neck pain, they have lower back pain. They may have gone to the doctor and been told that they have degenerative discs. Their discs are thinning out. They have a herniated or bulging disc. And oftentimes they're prescribed different medications. They're prescribed surgery oftentimes. Typically first it's different medications, pain medications, steroids, and then after those don't really resolve the problem, then they are given the option of surgery. And this is where oftentimes patients do come into us because they don't know what else to do. They don't want to have surgery. They're 65, they're 70, they're 75 years of age, and they don't really just want to go under the knife. And that's a very understandable thing because most of those individuals tend to have multiple other health conditions. If you look at it statistically, most Medicare patients are on at least 12 different medications. So even though patients are coming to see me because they have back pain or neck pain, most of them are on high blood pressure medication. They may be on cholesterol medication, thyroid medication. They may have had cancer, so now they're on cancer medications, and that just complicates their general health abilities. But one of the things that I always like to explain to patients, because they'll come in and they'll be like, oh, I have arthritis in my knee, or I have arthritis in my hip. And they think it's because they're getting older. And what I always have to remind patients of is the arthritis is not there because you are getting older. It's due to
use.
It's due to prior traumas and prior stressors to the body
Mm-hmm.
that don't allow that joint to adapt to whatever's happening. Because if age was really the cause of arthritis, then you would have arthritis in every joint, or you would have arthritis in both knees, not just in one knee.
Right.
And this is where so often patients come in and they may have arthritis in multiple different joints, but it's not in every joint.
Right.
And this is where you know that it's not just because they're 70 years of age.
Right.
Because you look on an x-ray and they have perfectly joints in other areas.
Mm-hmm.
And then there's one that's deteriorating. And it's because of that structural stress. There's some sort of mechanical stress that's occurring at that joint.
Mm-hmm.
And that is what actually wears that joint down.
What are the common types of the stress that you're talking about? Because I know my grandfather had a florist shop in St. Louis, Missouri, and my grandmother would help him, but she was excellent at making bows, tying bows, and her hands just ached. So in terms of prior trauma, we're not talking about, I mean, at times it can be, I was in a car accident, things like
Correct.
that, but then other times it could just be, I'm making bows, right? So what are some of the things that could cause the pain?
So, I mean, that's a great question, because it is. Typically, there is going to be some sort of traumatic stress, and that traumatic stress could be a fall. I mean, we know typically as individuals age, they do tend to fall more often. They have less balance, they have less strength. So there are more falls that do create further injuries. But oftentimes it's just due to overuse and poor posture. The mechanics are just off.
Let me sit up straight here.
Exactly. Whenever I say posture, everyone's like, oh, now I got to sit up straight. But due to long-term poor posture, long-term repetitive motions that are not being done correctly, then joints tend to become inflamed. And I mean, if you really just look at the word arthritis, it comes from the word artho, which means joint, and itis, which is inflammation. And so we look at arthritis as if it's this really bad thing. And in reality, all it is it's just inflammation of a joint, that if that inflammation sticks around for too long, that's what starts to cause the body's defensive mechanism. And we deposit calcium into that joint, which is what leads to bone spurs. And now we have what people refer to as arthritis. And it's just due to that constant inflammation. Now, one of the things that you will see most individuals, when they start to have symptoms of arthritis, they become very, very sedentary.
Because it hurts to use it.
Because it hurts to use it. And
that's probably one of the worst things that you can do.
It is definitely one of the worst things. And the example I give people is, just imagine on your car, if one of your brake calipers was seized up and the wheel isn't turning and you continue to drive, the tread on the bottom of that one tire would get worn out.
Right.
The other three tires are moving and spinning and they wouldn't wear out.
Right, but they're working harder to
deal with that one that isn't.
Yeah.
But all the tread on that one tire would wear out, and that would be what's known as arthritis. So actually, the lack of motion is what produces further arthritis and degeneration.
That seems, it's counterintuitive. And
it's the opposite of what most people think.
Right. That is really interesting. So what are some of the things that you do to help with that? Because I know to really diagnose, I mean, you can look at somebody's hands, and if their hands are have bumps on them and the joints are swelled, then it's a pretty good indication that they have arthritis. But you can't see it on an MRI or something, so you have to do an X-ray. So
Correct.
what is the process that you do for an incoming patient?
So and
I know that, when I've gone to other chiropractors, they want the X-rays, and I say, why can't you treat me without the X-rays? So what's the real role of the X-rays, and why is it necessary?
So, I mean, X-rays in the specific type of chiropractic that I do require X-rays on all my patients, particularly because of the way that we're adjusting the neck. It's very, very specific, and we need to be very precise and make sure we're adjusting the correct bone in the right direction. But even when we're dealing with individuals with low back problems or hip problems, particularly when you're dealing with individuals over a certain age, you do definitely want to make sure that you have an x-ray, because that x-ray is going to provide information. Are they already in an osteoporotic process? Meaning, are their bones starting to become more brittle? Because that's going to change the way in which the chiropractor is adjusting them.
Right.
Most chiropractors know multiple different adjusting techniques.
Okay.
And, harder isn't better.
Right.
You can't push harder to make something feel better.
Right.
Especially if they are elderly or they're osteoporotic. So you need to make sure that you are aware what's the condition of the bone. Is there a lot of degeneration? Is the disc completely worn out? Is there bone spurring? So this is where x-rays are very, very valuable, particularly with elderly patients, because we know that if they've been dealing with a history of, oh yeah, I've had off and on back pain for 25 years, you're going to see something that's not normal in that x-ray.
Right. And so for those who, everybody likes to, maybe not everybody, but likes to watch the videos where it's all about the crack and they have the microphone right there just so you can hear it. And a lot of people are apprehensive about coming to the chiropractor. I can tell you, I can attest, Dr. Seivert is very gentle. However, having the x-ray helps you determine what areas maybe you need to be more gentle on. And also, Dr. Seivert does a lot more than just subluxation, which is just movement of the joints. You also do a lot of muscle work.
Correct. I mean, when you're dealing with, particularly when we're dealing with elderly patients and Medicare age-based patients, if we're dealing with a problem that's been there for 15, 20 years, obviously you have the joint misalignment, the joint that oftentimes is stuck and not moving, which is what causes the wear and tear. But now you're also dealing with a muscular component. You get either muscular atrophy or muscular spasms. You get a lot of trigger points. And this is where you will see oftentimes many chiropractors will do soft tissue work. They'll deal with muscular. They may do exercises, give their patients home exercises.
Yes.
Or oftentimes even just refer out. I mean, we have several different physical therapists that we work with locally here, because in my office, I don't have the time to spend with every patient going over and doing the exercises. We will show them how to do things at home. We'll do soft tissue work with them. But sometimes it's best just to go to a physical therapist that's actually going to spend 45 minutes and just work those different muscles. And this, once again, is that example of motion is what helps. And this is why so often, even if you don't ever go to a chiropractor, you go to your primary medical doctor, if you're having joint issues, oftentimes they're going to send you to the physical therapist to get motion into the joint, get things moving, because the more you move, the more fluids come in and out of the joint, the more nutrients, the more blood flow, which is what helps heal those joints over a period of time, especially if you continue to do those exercises.
So chiropractic in and of itself is it helps, but I know there are quite a few people that say, I'm not going to do that. It doesn't impact me, I'm just going to go to my doctor. So how would you approach, what would you say to people who are saying, it's not all it's cracked up to be, right? What's on your
No pun intended.
No pun intended. Because it's not, because I know you mentioned if people are taking like high blood pressure medications, and sometimes people need to be on those, and they still need to go to their primary care doctor to help manage that. But that's also helping to manage symptoms. And so chiropractic and physical therapy really come into play, and it's kind of completes the picture. So maybe at some point.
Yes. And I mean, when we look at chiropractic, I mean, most individuals look at us primarily as bone doctors, as back doctors, and that is what we do help out a lot with. But what people don't realize is what lies within the bones of the back. And within the bones of the back is that central nervous system, the spinal cord, which is basically the extension from the brain coming down to connect to the rest of the body. And so oftentimes as we are adjusting patients for their back pain, their neck pain, their sciatica, oftentimes they start telling us, oh, you know what, my digestion is better. Oh, I'm sleeping better at night. Oh, I've noticed that my allergies aren't as bad, because those nerves in the back also go to other areas of the body.
Right.
So as we're improving that joint and helping decrease the inflammation,
Then,
also improving the function of the nerve, so there's better brain-body communication.
so would you say that if there's less inflammation in other areas, less of a focus, and your body has time to go to other areas and help fix those and just do the natural healing process?
Correct. I mean, when we look at our bodies are very, very dynamic. I mean, if just take example, a red blood cell in the body. I mean, your body is producing millions of red blood cells every day, and there's millions that are dying off every day. And that is your body's ability to adapt, is constantly kill off the old tissue cells and regenerate new tissue cells.
Right.
And so the best opportunity that you have is taking that holistic approach, and yes, using chiropractic to make sure your body is adapting to the environment as much as possible, but also taking responsibility of how can you help your blood pressure? How can you help your diabetes?
Right.
Well, look at nutrition. What are you doing? Are you moving? Are you sedentary? I mean, there's a very famous doctor that has actually said that more people die of a sedentary lifestyle than from smoking. Now, we all know the devastating effects of smoking,
Right.
but most people don't think of the devastating effects of living a sedentary lifestyle of sitting around. And today, in today's society, we, more so than any other country in the world,
We set our butts down on the couch
sit down
and watch TV.
And watch TV. People are on their phones all day, and they're in this abnormal posture like this, looking at their phones or on their computers. I mean, how many people work from home and work on a computer all day long? They're there for 8 hours, and then they get up and they go to the couch and they sit and watch television. And the bodies are designed to move. The more you move, the better you're going to feel.
Right. I mean, that all makes sense. I mean, you hear the 10,000 steps a day is that's just a number to shoot for, but I know you have to start small. So just because you can't do the 10,000, maybe you up it to 500 steps. You start small.
Exactly. I mean, if you're only doing 500, move it to 2,000, and you'll notice like, wow, that's a big difference.
Right. But if your body's used to not doing something for so long, you're not going to see that improvement right away, because it took 25, 30 plus years for your body to get like that. So you have to commit to coming back and doing the exercises at home, which I
she's not always the best.
I'm not. Just listen, do as I say, not as I do, please. Right. But so just by starting small and making these incremental changes, not only does it help you build better habits and keep those habits, but you're not going to be, you might be a little sore here and there, but it's not going to get better overnight. So thank you for all of that information. And kind of switching gears here, let's talk about insurance, because what I found was very interesting about Dr. Seivert is you take cash, but you also are a network with one insurance only, and that is Medicare. So why did you choose to accept Medicare and not others?
So with Medicare is a very interesting, the very interesting thing, particularly within the chiropractic profession. A general medical doctor has the option to choose to be in network or out of network with Medicare patients, and they can see that Medicare patient either way.
Right.
However, the laws are written differently for chiropractors.
Interesting.
And in order to see any Medicare age patient, you have to participate with Medicare.
You have to accept the Medicare assignment.
You have to accept the Medicare assignment. If you do not, you're legally not supposed to see Medicare patients as a chiropractor.
Is that just due to the liability, or?
It was just the way the law was written.
Interesting.
And so myself, one of the key reasons that I took Medicare is with the specialty type of chiropractic care that I do, I have patients that are coming in, and I've been at this location for 17 years.
And where you're located in Taylor, Texas.
In Taylor, Texas, correct.
If anybody's wondering, that's where the new Samsung is going in. But it's about 30-45 minutes outside of Austin?
Yeah, about 35 miles northeast of Austin. And when you look at Medicare, one of the things that I found for me was going to be the hardest part was dealing with patients. And then at some point, if I chose not to deal with Medicare, is looking at them and saying, okay, great, you've sought me out, you've seek care for the last 5 years, 7 years with me, we've had all these great benefits. Right. Now you're a Medicare age patient, see you later, you have to go somewhere else. I couldn't do that to my existing patients. So that's one of the key reasons that I took Medicare.
Continuity of care.
Exactly. But one of the good things is Medicare is actually very good coverage for people that need chiropractic care.
Which is not what you hear.
It's typically not what you hear.
Right, correct. Right. Because with Medicare, it covers the subluxation, which is movement of the joints and bones, but it doesn't cover it doesn't cover the muscle work.
Correct, yes. And with Medicare, they're not going to cover any of your physical therapy that's being done by the chiropractor. They're not going to do any of this soft tissue work. And in fact, an interesting thing is they actually don't cover the initial examination or x-rays, yet they require that there's an evaluation done before treating the patient. But they will cover, there is no limit really to Medicare benefits. As long as there is a necessity for care and there's a show of constant improvement. Now, once an individual gets to the point where they're stable, they're feeling good, and they just want to, like many of our patients, they just want to come in once a month or once every 2 months to maintain it. That's when Medicare says, and to see me, yes, and my staff.
Yes, the staff is wonderful.
But that's when Medicare is going to say, yes, we are no longer, you're now using this for wellness and preventative care. And this is where I will say I have my disagreement with Medicare, because they will no longer cover the benefits. And so here's where now we have to just work with the patient as a cash paying patient, even though they know that they need to continue to come in so they don't fall right back in the same position that they were in before.
Right.
And that's the one downfall with Medicare, that they just don't have preventative or wellness care.
Right. Do you think that's an obstacle to other chiropractors and providers and not wanting to accept Medicare?
I think it probably is, and it is, you know, there's some difficulties dealing with some insurance companies as a provider.
Right.
Now, I mean, obviously, as an individual that has healthcare benefits, there's a lot of benefits to it.
Of course.
But as a healthcare provider, there is a lot of obstacles, there's a lot of barriers, there's a lot of difficulties in submitting your paperwork to try and get paid for the services that were rendered. And this is where Medicare actually makes it probably one of the easiest.
Which is not something that you would think.
It becomes one of the easiest to actually, because the Medicare benefits are the same for all individuals.
Right.
And this is where it differs when you look at any of your other big commercial companies.
Right. Whether or not it's covered and not. Because, I mean, if somebody has an Advantage plan, Advantage plans have to cover at minimum what Medicare covers.
Correct.
So they cover the chiropractic, but there are, you've had some
there's some restrictions on it. I mean, some of the this is where it really becomes more difficult, because all of the Advantage plans are not the same. You could take Company A, and within Company A, they may have 5 different policies. One policy may cover the exam and the x-rays and preventative wellness care, so the individual gets preventative care. And then the next one doesn't cover any of those, and they just cover the bare minimum that Medicare covers. And it becomes more of a barrier for the provider, for the clinic, to be able to determine what actually are those benefits from one policy to another, whereas just straight up Medicare is, you know, it's the same for every individual.
Right. And so, you know, not saying that one is better than the other at all, but in the basics, it's going to cover that subluxation.
Correct. Yeah.
Okay.
And this is where, you know, oftentimes coming to my office or going to many other chiropractors' offices, sometimes there are going to be additional recommendations that we do give to you that are not covered by Medicare, and that would be your out-of-pocket expense, the actual visit and the chiropractic adjustment would be covered under the Medicare and oftentimes your Advantage plans. but it is oftentimes if there's secondary procedures, different therapies, or things of that sort that are being used, or nutritional consultations, those oftentimes are not being covered by.
And just to put it at rest, because I know I have had this concern when seeking chiropractic care, just because you're recommending these things to people, just because it's not covered by Medicare, you're not trying to pull one over on them.
Correct. I mean, in my office, the way that we work is we are always just trying to give the best recommendations as to what's going to happen. One is not obligated to do all of it. You can pick and choose what we have. Some patients that we give them the best recommendations and they honestly want it, but because of their own personal financial things, they can't. And so we give them the best that we can with what Medicare or their insurance is going to cover.
Right. And so you work with people.
We work with them and get them at least some improvement, some changes that are occurring using their benefits of insurance. And then there's other individuals that, they have better means of doing additional care. So they want, okay, what additional things can I do to make sure that this is like fully handled and it's not going to continue to hinder my lifestyle.
Right. But there's something that you can do for everyone.
I will say in most cases, there's going to be something that we can do for 98% of the individuals. And if we find that, your particular case is one that it's not going to be beneficial for what we do, at least in my office, we are definitely going to let you know, and we're not going to waste your time, because I want my time dedicated to helping those that I can help.
Right. So as we close out here, what are 3 things that older adults can do as they age to really help be in less pain?
So,
1, to see a chiropractor.
Yes. I was going to say, you could keep it very, very simple, and you can say those 3 things comes down to chiropractic adjustments or chiropractic care to make sure that your spine is staying well aligned and joints are moving, good nutrition, and exercise. Those are really your key things. But even, we can break it down a little bit further. If you are an individual that you are suffering and dealing with a lot of arthritis, one of the things that you can really look at is there are a lot of great supplements that you can take. If you've already, I eat good, I don't know what else to do, I have so much inflammation. There are a lot of great supplements that you can use to help knock down the inflammation without just taking more steroids or taking more
pain medication.
Pain medications. The studies do show that people that take NSAIDs, non-steroidal anti-inflammatory drugs like Tylenol and things of that sort, it actually causes further degeneration.
Really?
We know that it causes digestive issues and liver issues, which is why they tell you not to take it in excessive quantity.
Or to drink when you're
doing it. Exactly. But on a long-term basis, it can actually cause further wear and tear of those joints. So, it can be used you can use it wisely and you can use it beneficially, but you also need to look for other solutions. And just to give you some hints of, just some really easy things like turmeric. Turmeric is a great herb that can help. So is boswellia. There's multiple different things that you should consult with your provider, but there's many different herbal and supplemental things that an individual can do to help really decrease the inflammation of arthritis.
And is one of those forms of with turmeric tea?
You could use it as a tea. There are multiple different types of, many times you're going to get your more potent types of turmeric in a capsule. So that way you can just take it as a daily dosage in that aspect.
And all supplements are not made equal.
All supplements are not made equal. You should talk to your healthcare provider, your chiropractor, your nutritionist, because sometimes for example, with turmeric, if you're going to take it, there are some things that you should take along with the turmeric to get better absorption. And so,
like if you're taking iron, take calcium to help with the absorption of the iron.
Exactly. So there are all sorts of different things, but I will also say I'm going to add a fourth.
Oh, here we go.
Fourth one, and that is drinking water.
Oh, yes.
There are so many individuals in our society that are dehydrated because people drink coffee, tea, sodas as you're drinking your coffee.
As I'm drinking my coffee.
Sodas, soft drinks, things of that sort. And Americans in general just do not drink enough water. And when you look at so many problems of the spine, especially individuals that are dealing with disc herniations, disc bulges, degenerative disc, one of the number one reasons that is occurring is because there's dehydration in that one particular disc, which is what causes it to degenerate.
It's a domino effect after that.
It's a domino effect after that. So making sure you are drinking plenty of water, keeping your body hydrated, taking electrolytes. Definitely, I've had individuals that are in joint pain, and all I do is I get them just drinking more water, and they're like, oh my gosh, I feel so much better, just because they're hydrating their body.
Right.
So that's the fourth thing.
The fourth thing. Okay.
Yeah.
Well, thank you so much for your insight and joining me here for the very first episode of Medicare Matters with Mackenzie. Stay tuned. We will be talking, you might see Dr. Seivert again, talking about a different aspect of chiropractic, but stay tuned. We're going to be diving into not taboo topics with Medicare, but the things that there's a lot of misunderstanding about. So Dr. Seivert, how can people get in touch with you if they have questions, or if they want to become a patient, or just come in for maybe just a little consultation?
Yep. I mean, there's two ways. You can always just call us at our office at 512-352-1300, or you can go to our website at www.atlasnaturalmedicine.com. And we have all sorts of different exercises, different sources of information for you there.
On your website?
On our website.
Wonderful.
And there's also a way that you can directly reach out to the office. And even if you're not here in the local Taylor area or in Central Texas, that's fine. You can always reach out to us. I know chiropractors all over the country that I can try and help you get set up with somebody in your local area.
Well, thank you very much. And we'll talk to you soon.
All right. Thanks, Mackenzie.
Thanks for listening to another episode of the Medicare Matters podcast with Mackenzie. Please make sure to subscribe wherever you get your podcasts so you don't miss an episode. Please also leave a review, as that helps me reach more people that can benefit from this podcast content. If you have questions or topics that you want me to cover for a future episode, please email them to Mackenzie@premiermedicaresolutions.com.